If you've been watching Bundibujo surveillance, this outbreak wasn't a shock. But it just pushed a stalled global treaty back onto the table, and the word in the headline is, again.
This is Ebola Watch. Today, why 500 deaths and a multi-country spread are apparently the jolt a room full of negotiators needed.
And in Step Back, what cross-border coordination actually means, the moment a contact walks from the DRC into Uganda. Who's holding the file?
Hit follow, and you won't have to come looking for the next episode.
The Straits Times writes,
Geneva. World Health Organization, WHO, member states kicked off one more attempt at finalizing the missing piece of the pandemic treaty on July 6th, with the Ebola outbreak injecting a fresh sense of urgency.
So member states picked the pandemic treaty talks back up yesterday at WHO headquarters, specifically the piece they couldn't finish in 2025, the pathogen access and benefit sharing system. Tedros framed this outbreak as a reminder that a threat can spring up from anywhere, and I gently push on that word, anywhere. Bundibugyo isn't a surprise to anyone watching the surveillance gaps there. The tools were built too late, and that's the part this outbreak keeps reminding us of.
The headline is, Try Again. Again. The treaty was adopted in May 2025, and they left the actual working mechanism out just to get the deal over the line. So what's the jolt threshold here? 500 deaths and a multi-country spread finally counts?
Right. And look at what's filling that gap right now. The emergency use listing for the Bundibugyo molecular test, the EDCTP3 €4 million mechanism. Those are stopgaps standing in for governance that should have been formalized already.
Here's what nags me, though. Tedros says anywhere, but this is a strain with no licensed vaccine and no approved treatment. Does the treaty text even name novel or under-resourced strains? Or is it written for a world where the tools already exist?
That's exactly the fault line. If countries can't agree on shared case definitions, confirmed versus probable versus suspected, in a treaty, then the interchangeability problem I keep flagging goes way past sloppy reporting. The governance failure is baked in at the top.
When officials talk about cross-border coordination for Ebola between DRC and Uganda, what does that actually mean on the ground? Who's tracking a contact once they walk across the border? And how do you share lab results and get someone into care without just slamming the gates shut?
It's a genuinely complicated handoff. The short version is, it only works if multiple governments are using the same procedures at the same time. Right now, the base is a joint framework Uganda and DRC health officials finalized at a 2-day cross-border meeting in Aru. Per that reporting, they're locking in arrangements for a joint Ebola response plan covering surveillance, information sharing, and emergency response along the shared border. On the lab side, Uganda deployed a mobile lab to Bwera Hospital, right on the DRC border, so specimens don't have to travel far for confirmation. That detail comes from Uganda's Ministry of Health Permanent Secretary, Diana Atwine. At the ministerial level, the health ministers of DRC, Uganda, and South Sudan convened in Kampala on May 22nd and 23rd, with WHO and Africa CDC facilitating, and produced a communiqué explicitly committing the three governments to a coordinated response. So the diplomatic architecture, at least, is in place. The hard part is that coordination assumes open channels. WHO and Africa CDC have both advised against border closures as a containment tool, warning of COVID-style trade disruptions. Uganda still ordered its border with DRC closed on May 27th, which makes the contact tracing pipelines these agreements are meant to build much harder to run.
So with the border closed, how are Uganda and DRC actually supposed to coordinate on the ground? Is anyone physically crossing to do the work?
That's the operational friction to watch. Uganda announced it would deploy 80 Ugandan medical personnel into DRC, which suggests the two governments are trying to keep a health corridor working, even with formal border controls in place. The fake declaration, WHO's highest alert level, issued by the Director General on May 17th, keeps international pressure on both governments to keep those lines open. Now we watch whether the Joint Response Plan's contact tracing and lab sharing protocols can actually hold up under a border closure.
If you follow Ebola Watch for clear public health updates, try Food Recall Watch. Daily FDA and USDA food recalls, allergy alerts, and outbreak-linked notices, from salmonella and listeria to pet food advisories. Find it wherever you listen to podcasts. You'll find links to every story we covered today in the show notes, along with the original sources if you want to dig a little deeper. If something caught your ear, that's where to start. That's Ebola Watch for today. This is a Lantern podcast.